If you struggle with shyness or social anxiety, check out our free No BS training course with actual useful advice you can do from home. None of that just get out there nonsense. The link is in the description below. For now, let's get to today's question.
The question: what therapies are successful when treating social anxiety disorders? Social anxiety disorder is nasty, and I feel tremendous sympathy and compassion for you. It's unlikely you'll find anyone on this site who has as deep an understanding and knowledge about social anxiety as your current writer. It'll do well to pay close attention to my answer, as I care deeply about people with social anxiety. As you no doubt know, social anxiety disorder dominates sufferers' lives. It negatively impacts life in a million ways. I feel for you, and pray you find treatment. I advise strongly that you find a psychiatrist who specializes in anxiety disorders, and better yet, social anxiety disorders. Better yet, if there is a university-affiliated medical center near you, call them and see if they have a center/clinic that specializes in social anxiety disorder. Most treaters have very little understanding of the terrible toll this disorder takes, and less idea of how to aggressively treat it. Social anxiety is disabling, and, unless you are a sufferer, people in general have no understanding of how crippling this disorder is. My ex-spouse used to laugh, as getting nervous before a party seemed, well, silly. Okay, I want you to know I get it, but you should also know that finding the right medicine is usually only part of the treatment, although I've had patients show remarkable responses at times. So, you've probably tried Toastmasters, individual therapy, and group therapy, but nothing seems to help. Rest assured, combination therapy usually works, but medicine was always a part of my patient's treatment plan. Therapy alone just never worked. The serotonin selective reuptake inhibitors, SSRIs, are the go-to medication. They almost always help. The problem I saw again and again and again is that treaters rarely knew how to dose them, and almost always were too conservative in dosing. I'm not a big fan of benzodiazepines in social anxiety. They help temporarily, but anxious people will often chase the calm, as I call it. They keep needing an increased dose, and never achieve a satisfactory, stable increase in their confidence. The beta blockers, used in cardiac problems/hypertension, can help, and I sometimes use them for patients with residual symptoms in combination therapy. A combination of appropriately dosed SSRIs and individual and group therapy almost always help my people. Because of confidentiality, I can't talk about some of the remarkable improvements people commonly make, from homeless to Hollywood honestly, but get treatment. The best, kindest, most compassionate people in the world have been social anxiety sufferers. The socially anxious people were always kind and compassionate. The one thing holding these people back from living fulfilling lives was their social anxiety. A psychiatrist with an understanding of how to treat this disorder can change your life. Get treatment and join the world. Find more answers and a free audiobook on how to talk to anyone in the description below. No useless advice like just get out there. I mean actual useful advice from people who have really dealt with shyness and social anxiety and overcome it in their own lives.